So there's a problem about the lack of affordable health care for low-income children in the United States of America. 45,000 children died every year due to the lack of health care. So my purpose today is to inform you the severity of this problem and what the barriers are that contribute to this problem. The lack of affordable health care for low-income children is a problem that can be attributed to poverty, high cost of the insurance, geographical and informational barriers. Millions of low-income children still have trouble getting affordable health care in the United States of America. There are 73 million children under the age of 18 years old in the United States of America, and 20.3 million lack access to health care. The lack of health care insurance is associated with as many as 44,789 deaths annually in the United States of America. There are families living near or below the poverty level that have the highest risk of being uninsured. There's a total of 47.5 million of low-income working families in the United States. Families below the poverty level is categorized as a family of four earning less than $23,000 annually. Uninsurance increases when the family income is between 100 to 150% of the poverty level, and even more so when the families do not have employer-offered health insurance. 8 in 10 of uninsured children were in families with incomes below 400% of the poverty level in 2016. Working low-income families face a troubling trend of an eroding of children's health coverage under employer health plans. Employers are dropping dependent health care coverage for their employees due to the high cost. There are parents that have to stay home to take care of their sick children, and they lose almost 3 million working days each year nationwide. So next up, the following info will provide statistical and demographic data of the people who are affected by the problem of lack of affordable health care for low-income children in the United States. The number of uninsured children has hovered around 16% between 1998 to 2007. The number of uninsured children aged 18 and younger grew by 710,000 to a total of 9.4 million in 2006. And then it dropped in 2018 to 3,277,000 due to the enrollment in Medicaid and CHIP, which is also called Children's Health Insurance Program. In 2016, there were 27.5 million non-elderly uninsured. 44% are non-Hispanic, 42% are people of color, 78% are US citizens, and 22% of uninsured are non-citizens. In the United States, 8 out of 12 states with the highest uninsured rates in 2016 were in the South, and 4 out of 12 states with the highest uninsured rates were in Alaska, Utah, North Carolina, and Tennessee. Next up, the following are 2 government programs that currently exist that provide health care for children from low-income families, but there are problems. First one's Medicaid. It was found to have problems related to reimbursement rates being too low, and low medical reimbursement rates makes it financially prohibitive for doctors and medical providers to accept patients with government-funded health insurance. The second one is CHIP, which is Children's Health Insurance Program. It's a block grant that funds health services for 2 years, then needs to be approved by government in order to be continued. More than 40% of these children are insured under these 2 programs. Next part is about the geographical and informational barriers, which contribute to difficulties accessing healthcare for children from low-income families. First one's about geographical. There are citizens with low income that live in financially depressed or remote rural areas that the poor public transportation, they may not afford a car, which makes it difficult to get a healthcare provider. 14 million low-income children live in remote rural areas and has an increased likelihood that live in an area where there's a shortage of healthcare providers. In conclusion, the lack of affordable healthcare is a problem that can be attributed to poverty. The purpose was to inform you the reasons why millions of low-income children still have trouble getting affordable health care in the United States. The following barriers that makes it difficult to access healthcare services was poverty, financial, geographical, and informational barriers. We as individuals have responsibility to elect people into Congress that can write and pass laws to improve the health systems. Thanks so much.